For my OMT minute today, we will be discussing tension type headaches. Tension type headaches, or headaches in general, are a very common complaint, specifically in the primary care setting. Headaches themselves can be considered the second largest cause of disability behind low back pain, which is very surprising to me. I know people personally who have headaches. We all have friends, family, patients we've seen who have had headaches, so we know it's a real thing and it's everywhere. So tension type headaches could be a headache that might be described as a band-like distribution around the frontal lobe, parietal, and the occipital regions. Many people will have occipital, or some people might even call them cervicogenic headaches. The pathophysiology could be thought to be due to multiple different things: autonomic dysfunction, regional changes in blood flow, hypertonicity of musculature in that posterior cervical region, or just even in the upper head and neck area. That's where we're going to focus our OMT today as well. It's been shown that stretching or doing articulatory techniques to the upper cervical, or even the head, the lower head, and the occiput and the occipital region can all reduce the frequency and duration of tension type headaches. Tension type headaches could either be considered episodic or chronic, and this OMT, that paper that I read, showed that I was able to reduce the duration and intensity of those headaches, which is key for us. If we can reduce the duration, we can reduce the frequency, we can get people to work more often, people can feel better in their day-to-day life, and they're able to function greater. They should also have a lower allosteric load. So the technique that I would like to show, or moreover describe, would be the posterior cervical stretch. When you have your patient laying supine, head facing up, and the physician or the operator is going to be standing at the head of the bed. Sorry, I don't have a patient today to demonstrate on. I might be able to show them a little bit. But you'd be standing at the head of the bed with your arms sort of at a diagonal angle, where you'd reach onto the patient's opposite sort of trapezius or onto their clavicle, and use that as your lever arm to change the angle at which you're going to stretch these posterior cervical muscles and posterior neck muscles in general. Let's see if we can sort of demonstrate it. So if this was their clavicle, I'd have my hand on their clavicle, my forearm extending behind their neck to their occiput, and then I can leverage my arm to change the position of their head and neck to change the stretch that I'd get. So from beginning to end, we have the patient lay supine, and then we get a feel of the range of motion for the neck and the musculature in all different directions, so we could feel the fascial strains and the hypertonicity and different somatic dysfunction, so that we could actually do our technique and then reassess to see if we treated the somatic dysfunction. Hey, Maverick, come on, up here. My patient isn't willing to cooperate, aka my dog. But that was my OMT minute, and I think that posterior cervical stretch is a great technique to aid in the reduction of strain in this posterior cervical region. I think it has a lot of great utility. I think if we supplemented that with the cervical articulatory technique and finding NBLT in this region, I think we'd have great success in trying to reduce the number of headaches, specifically the ones that are cervicogenic in nature, arising through hypertonicity in this posterior chain, causing change in the autonomics by changing the afferent signals from coming into the brain, but also changing the signals coming out to the musculature, which could change the hypertonicity there as well as the regional blood flow in that region.